Is it possible to know if you're at risk of a stroke or spot the early signs before it's too late? Every year, strokes silently change millions of lives, and India is no exception. Globally, it's the second leading cause of death and the third leading cause of disability. In the last 30 years, stroke cases in India have jumped by over 50%, with more than 1.2 million new cases in 2021 alone. Yet, shockingly, only a quarter of Indians have access to hospitals that are ready to handle a stroke. The risks are all around us: high blood pressure, diabetes, pollution, and long hours sitting at a desk. But here's the twist: technology is starting to fight back. From AI powered diagnostics to wearable devices and telemedicine, early detection and personalized prevention are no longer science fiction. They're becoming reality. Today, we go beyond the stats. We have three guests with us today who are on the front lines of transforming stroke care in India. Together, we will uncover how early action can literally save lives and what every listener needs to know today. I'm Neha Vashisht from the Economic Times, and in this episode, we have Dr. Sukalyan Purkayastha, Head, Department of Neurointervention and Endovascular Surgery, Institute of Neurosciences, Kolkata; Dr. Tariq Mateen, Director and Chief, Department of Neurointervention, Artemis Hospital, Gurgaon; Dr. Anand Alukar, Head, Department of Neurovascular Intervention, KEM Hospital, Pune, and past President, India Stroke Association. Thank you to all three of you for being here with us today. Thank you so much.
Thank you, Neha.
So I'll start with Dr.
Thank you.
Alukar first. Dr. Alukar, India continues to face one of the highest stroke burdens globally. What are the clinical, infrastructural, and awareness related barriers that delay timely stroke diagnosis and care in India?
So, coming to the incidence of stroke, you mentioned a figure of 1.2 million. We feel like the figure is much higher actually because stroke many times goes underreported. The figure is closer to 15 lakh or 1.5 million per year actually, which is a huge figure by any standards. Coming to these three factors which you mentioned, I think awareness is the most important part. Awareness Awareness of the symptoms and signs of stroke is an extremely important part. I always tell my students or in lectures or communications to the lay public that stroke has to be diagnosed at home. If stroke is not diagnosed at home, you're already too late. So, this awareness, for example, when a patient has a chest pain and he has breathing difficulty and things like that, 90% of the time the family members will be aware that the patient is landing up in a heart attack. So that is not the case with stroke. What happens is they are not aware of the signs and symptoms of stroke. Then they go to the family doctor, then they go to a physician, and by the time they land up in a stroke-ready hospital, many times it is too late. So this awareness of the signs and symptoms of stroke is extremely important. And as I always say, stroke has to be diagnosed by the family at home, and then only we'll be able to catch the patient in the golden hour and offer him the best available treatment.
All right. So, coming to the early screening part, my next question is to Dr. Sukalyan. Dr. Sukalyan, how can early screening for hypertension, AFib, and metabolic disorders be integrated into primary health care to prevent strokes before they occur? What are your thoughts on that?
Right. So, yeah, that's a very important question you have raised. Although the stroke is the second largest cause of death and very high disability if it's not treated, but the stroke actually, to some extent, it is preventable. And all these the points what you have raised, they are all preventable points. So the early diagnosis, and if you can prevent those risk factors, then the stroke can be prevented very well. And it should start actually in the primary care level. So when a patient or anyone with high risk should goes to a physician, be it in the primary level or in a tertiary care hospital, these parameters are very important to check. So out of which like I would say the BMI, body mass index, the what is the whether the patient is obese or not, the risk factors like whether he smokes, his blood sugar level, the blood pressure level, cholesterol. That should be, all these things should be checked, and at the same time the heart condition also should be checked properly, because any irregular heartbeat, like what we call atrial fibrillation, or any other irregularity in the heartbeat, can predispose the patient for stroke. So these few things are very important to check. So if we keep checking all these points, so to a large extent the stroke can be prevented. That's why I think.
All right. Dr. Tariq, let's move to you and understand how tech and healthcare ecosystem is right now. How are technologies like telemedicine, portable imaging, and mobile stroke units transforming early response in acute stroke management right now?
So, as Dr. Alkar was saying, that we need to identify stroke at home for an early response. But unfortunately, as a population or as a we are not able to identify that because there is a one important thing which separates it from a cardiac attack is the lack of pain. So the patient don't have pain, so they just live with the symptoms and they try to avoid reaching to an hospital. Then the next level comes when they reach these hospitals, whether they these hospitals or centers are they ready to identify stroke and act upon. So in this endeavor, we have been connect with our lot of peripheral centers. This we have been working for last half a decade, where we try to connect with them on phone, WhatsApp, whatever is possible. That's a telemedicine, what you say. In fact, you will see the American Stroke Association guideline, which is the latest guideline, which was their 2019 and thing, which have acknowledged the role of telemedicine in an acute stroke care, which helps in identifying this patient. So these patients need to have an access to a comprehensive stroke center, which are connected either through some way. It can be a AI-based platform. It can be just a WhatsApp. It can be just a call where they do an imaging, and when then we identify these patients. Yes, they need a higher care or they need a care which can be just delivered to them through a telephonic advice. This is the way probably that we are going to reach out to these patients where we definitely there is a definitely lack of services, lack of treatment which is there. And in this endeavor, probably the mobile stroke units and the portable things, which we have not yet any first-hand experience with it, but they are definitely going to also help in these things. So whatever the endeavor is to identify and we have to catch this stroke in evolution. Whatever is the way, the telemedicine is a uh, very powerful way, very way where we can utilize this thing to transfer these patients to a comprehensive strokes unit.
All right. So I have a follow-up question from you. AI and data analytics are shaping the healthcare industry and every other industry as well. So how can AI and data enhance risk prediction, triage, and outcomes in stroke prevention and treatment right now in today's times?
It's helping a lot. So for we are in a start of a AI revolution in every aspect, as you have rightly mentioned, and AI is going to be major role in most of our decision makings. So in this thing, probably what we have started is identifying the stroke from the imaging aspect. There are few of the softwares, the AI platforms, which identify a stroke in evolution in their early phase in from the imaging thing. So we have with the also incorporated in our hospital these AI platforms to be connected to the satellite centers where we can identify stroke in evolution, where the imaging is being done with a clinical diagnosis of a stroke, and then we say, okay, this is indeed a stroke, and this is a large vessel stroke. And we are working on another thing, which is probably a clinical diagnosis of a large vessel occlusion or a stroke and a large vessel occlusion based on data analytics. This is one of the things where we probably need more data and the industry needs to work on that platform. There we can identify a stroke, and we can identify a large vessel stroke. As we are aware, there are certain signs and symptoms of a large vessel stroke which carries a very high morbidity and mortality associated with the stroke burden. If they are identified, we can probably transfer them to their respective facilities, and we can reverse the stroke burdens and decrease the stroke burden.
All right. Now, moving on to lifestyle, Dr. Alukar, how do you think lifestyle factors contribute to this entire situation? Lifestyle factors are a major contributors to the rising numbers in today's times. What can be done to maintain healthier routines, and what helps in maintaining heart-brain wellness?
Yeah. So as you rightly mentioned, lifestyle factors play a huge role in the incidence of stroke, and they are especially important in patients who already have a family history of stroke or who have had a minor or major stroke in the past themselves. So controlling lifestyle factors is extremely important. One of the topmost will be prevention and control of diabetes because it is a very major risk factor for stroke. Prevention and control of blood pressure, hypertension. Now, here I would like to mention that many patients, after the diagnosis of hypertension or diabetes, they are on medicines for a long period without any follow up with the doctors. The blood sugar or the blood pressure is not checked. And as long as they are not having any symptoms, they think that just continuing the whatever dose has been started is enough. So that is a very common mistake that is done. So patients of diabetes and blood pressure who have been started on medicines need to regularly follow up with their physician and check the blood pressure and blood sugar so that the doses can be adjusted. Thirdly, smoking is a very important lifestyle factor which causes stroke. Absolutely, smoking has to be stopped after a stroke, and I mean, even before a stroke. If anybody already has another risk factor for stroke like diabetes, blood pressure, obesity, smoking has a multiplier effect. It is a very dangerous risk factor for stroke. So smoking has to be absolutely stopped. Obesity and sedentary lifestyle are also very important risk factors for stroke. And control of cholesterol. Part of it is obviously exercise, having an active lifestyle, and sitting, they say, is a very important risk factor for heart disease and stroke. The longer you sit in the daytime, the more are the chances that you'll get a heart attack or a stroke. So you have to keep moving. You may not do exercise for exercise sake, but at least you may not find time to do that, but at least keep moving. And if you have a profession that requires you to be sitting for a long period, you have to take breaks every half an hour or so, a 5 minute break every half an hour, and keep walking. The more you walk, the less are the chances that you'll get a heart disease or stroke.
So, Dr. Sukayan, how are stroke and heart health connected, and why is managing them together key to better outcomes?
Yeah, that's a very pertinent question because heart attack and the stroke, these two diseases, they are very kind of interrelated because whatever are the risk factors, what we encounter for stroke, they're same as in heart attack, like lack of exercise, high cholesterol, diabetes, smoking, excess intake of junk food, and also the genetic predispositions. They're all same. So that's why whenever we encounter a patient of brain stroke, we also at the same time evaluate the patient for the possible risk factors for the heart attack. And at the same time, whenever a patient we encounter for heart attack, we should also look for the problems which can predispose them for getting a future stroke. And if you see the pathological process, both in the acute ischemic stroke and the acute coronary syndrome or the heart attack, they are also the same. The atherosclerotic disease, the cholesterol deposition in the arteries of the heart and the brain is the same kind of pathology which is happening in both the system. So I think they are just the manifestation of the same pathological process in the two different organ systems of our body, the heart and the brain, and they're kind of all interrelated. So I think we should look at the disease as a whole and
Yeah.
evaluate the possible causes of heart attack and the stroke in all the patients at the same time.
So, Dr. Tariq, what are your thoughts on wearables and remote monitoring in today's times? It genuinely helps in continuous cardiovascular tracking. How close are we to incorporating these tools into mainstream preventive care for high risk populations, especially when we talk about India? How do you think wearables and remote monitoring can help patients, and specifically when we want to, get an idea of early signs?
So, as discussed, as has been elaborated by Dr. Arulkar in the previous question, so there are certain risk factors which needs to be very closely monitored whether these modifiable risk factors are under control or not. So, as he was telling, the diabetes is one of the, and we are becoming a diabetic capital of the world. The diabetes burden is increasing. There are two modalities where we are employing a remote monitoring and continuous variable monitoring. One is the continuous glucose monitoring, which helps you to understand more of the nature of the diabetes, whether it is controlled or not. There are certain surges in the blood sugar after eating, which may go undetected in a monthly scan or a 3 monthly average scans, which is otherwise itself is a big risk factor. The other variable monitors we are employing is a heart rate monitor, that's the ELR, extended loop recording, where we try to eliminate the cause of a cardioembolic stroke through an atrial fibrillation, which is one of the cause where we may miss in 24-hour monitor or we may miss in the hospital investigations. So these are the two very important things. And probably the other thing, as discussed by Dr. Alkar, was about the continuous sort of a physical activity. These variables are can be very easily monitored. What tools we have got, the heart rate and the your yield monitors and the calorie monitors. So we are very frequently using the continuous glucose monitoring and extended loop recording, that is measuring your the heart rate variabilities. And there are certain things which a patient can himself or herself can monitor, is about the physical activity monitors which are there.
I will move to Dr. Alukar now. Dr. Alukar, there is a lot of access disparity going on in India. It's a major challenge. So, what should be done to make advanced stroke care more widely accessible across our country? What are your thoughts on this?
Yeah, I think that is the most important thing which needs to be addressed at all levels, at the level of us doctors, at the level of the society, as well as the level of the government. So, access to advanced stroke care is lacking in our country as compared to the rest of the world. That is a fact. And although we have the best available expertise, even if you compare to the rest of the world, it's not available to most of the population. That first is the rural and urban divide. So, advanced stroke care like comprehensive stroke centers and cath labs, they have not yet reached the smaller towns and the rural areas. So, that is one factor. Secondly, expertise to do the advanced stroke care like mechanical thrombectomies it is still lacking as far as the smaller towns and the rural areas is concerned. And as far as IV thrombolysis is concerned, the problem is I think leveling out, because we are seeing many physicians, MD physicians also carrying out IV thrombolysis in these patients, and here technology helps. Many physicians in rural areas or remote areas, they consult us, send us the images and consult us on social media, WhatsApp, and we guide them. So, as far as IV thrombolysis is concerned, the access disparities, I think, sort of leveling out. But as far as mechanical thrombectomy is concerned, it is still a major issue. So, the government has to think about two things. One is infrastructure, development of infrastructure in the smaller towns and rural areas, and availability of expertise also to carry out these procedures in the smaller towns and rural areas is very important. So from our side, we are training more and more people, and actually what we do is, as senior people, we give preference to students who are coming from the smaller towns and rural areas. So they'll go
Yeah.
back to their hometowns and uh, start giving the best stroke care that is possible. So from our side, we are doing a lot individually as well as through associations like the Indian Stroke Associations and SNVI and STNI, etc. We are doing a lot, but there is still a long way to go.
Absolutely. So, moving on to Dr. Sukalyan now. Dr. Sukalyan, how critical is the golden hour when we talk about stroke management, and what role do emergency services and primary care physicians play in early intervention?
Yes, absolutely. Because the golden hour, what is meant by the time actually, and if you see the theme of this year's the Stroke Day, World Stroke Day, that says that every second or every minute counts actually. So that is the concept of the golden hour. And what we see in the golden hour for the heart is around 3 hours, and in the brain also it should be around 3 hours. That means we should not be wasting any time. In some cases, we can extend the time even up to 4.5 or even 8 hours, or even sometimes up to 24 hours. But that does not mean that you can wait that long. It is that what our previous speakers have also emphasized, that the stroke should be diagnosed at home and without wasting any time. Anytime they should go to a stroke ready hospital where it can be treated. And in the emergency itself, the stroke should be differentiated from any other similar diseases because the treatment is completely different. So if you can, in ER or emergency, you can diagnose stroke without wasting any time, you can institute the treatment, that is either IV TPA or mechanical thrombectomy without wasting any time, and the chances of recovery increases manyfold if we can revascularize the brain arteries and establish the circulation in the brain without wasting any time. So obviously, every minute counts in that respect.
Dr. Tari, can you explain how technologies like mechanical thrombectomy can aid in early intervention, and what are the implications for that?
So I would say mechanical thrombectomy has revolutionized the acute stroke care, ischemic stroke care. It was a paradigm shift which happened in 2015 and which has continued its evolution till now. And probably we will see much more things in the future where it's going to give a revolution to the acute ischemic stroke care. I very vividly remember 2013 we were doing these therapies at this hospital only, and we were aggressively doing, and then suddenly the trials came in which said you are not doing any good. And we were so disheartened by that trial. I remember we talked to our neurologist and we were sitting in a group drinking coffee and said, okay, what is there? What's wrong with these trials? And then subsequently in 2015, we got a series of trials back to back, five trials, and then subsequently lot many where it has said it has got a class one level of evidence A. That's the highest evidence it got
Yeah.
in a medical literature, and the numbers needed to treat were very powerful, impactful, which was there. I would say this is one therapy we need to take these therapies as has been discussed. There is very less number of mechanical thrombectomies happening, and where we can catch acute stroke in evolution and reverse these symptoms. We have seen this therapy working wonders. We can prevent these patients from becoming inanimate furniture-like thing. Almost they become uh, furniture after a big stroke in a side of the one side of their home, and they are neglected like anything, and then they decay over a period of time. So these therapies prevent those eventualities and bring these patients back to their life.
All right. Dr. Alukar, would you like to add anything to this?
Yeah. I'll just add to what Dr. Tari just said. He mentioned about the NNT. So I would like to convey to whoever will listen to this podcast that mechanical thrombectomy is the most effective treatment on the human body ever. We go by a scientific concept called the numbers needed to treat NNT. The lower the NNT, the more effective the therapy is considered. So for mechanical thrombectomy, the NNT is lowest amongst all therapies in all organs of the human body. So it is a very, very effective therapy. And it's not that after each and every patient will improve 100%, but it causes significant recovery of the patient. And we also have to compare with the patient who do not undergo mechanical thrombectomy. These patients, as Dr. Tariq mentioned, they do very badly. Many times they remain disabled throughout their life. So this is actually a boon to. It is. I would say it is as significant an advancement in medical care as antibiotics were. So it is a very significant advancement in medical care, and I hope that most of the patients in our country are in a position to avail of it in the future.
All right. What are your thoughts about the theme of stroke pay rok as a means to create awareness towards preventive and public engagement measures? What are your thoughts on that, Dr. Alukar and Dr. Tariq both?
Highly appreciable, much needed. These, and we need much more than these, because as has been time and again reiterated, that we have lack of awareness, stroke awareness among the society on both the preventive aspect and the treatment aspect. When the stroke is happening, we need to identify stroke, we need to reverse these stroke symptoms which are happening, and we need these strokes not to happen on the first hand itself in the human body. So we need a lot of these efforts. It has to be a very long, tiring effort, but we see a very. I'm very optimistic about the future. With these efforts, we will have a better outcome, and we can definitely reduce the stroke burden in our society.
All right. So, one thing I wanted to understand from both of you is that what are the top three early signs that you think, as someone from the medical field, are the top signs to understand if someone is going to have a stroke in the near term? We can start
Yeah,
with the Dr. Alukar.
yeah. So in general, what I tell my patients is, or the family is, that any symptom coming on one side of the body and coming suddenly should be considered a stroke unless proved otherwise. At the most, what will happen is if you take the patient to the hospital, the doctor will say this is not a stroke, it is just one trip wasted. But any symptom coming suddenly over minutes to hours and coming on one side of the body should be considered a stroke unless it is proved otherwise. So, of these symptoms, one can say if you go from top to bottom, loss of vision on one side, deviation of face to one side while talking, slurring of speech, heaviness or numbness of one arm, heaviness or numbness of one leg, or both arm and leg, and losing balance to one side. If any of these symptoms alone or in combination they come suddenly, this has to be considered a stroke. And here I would like to stress on a concept called transient ischemic attack, TIA. So these are very small strokes which the patient gets and the patient recovers within 1 or 2 minutes or 5 minutes. So many of these episodes are neglected by the patient as well as the family doctors and physicians. So just like a patient of heart attack sometimes gets many times gets minor chest pain before the actual major heart attack. Similarly,
Yeah.
a patient of stroke, major stroke, will get these. Many patients get these small attacks which recover by themselves in minutes. So this is very important to understand so that strokes are diagnosed early.
All right. Dr. Tariq, would you like to tell us any other three top signs for basically understanding if someone is going to have a stroke early on?
So we have a very well circulated acronym which is FAST, and as Dr. Alka was telling, I used to say anything happening suddenly, which is negative, which the patient was doing and not able to do. The person was able to do before and is not able to do it. Probably what we are staring at is a stroke in evolution. If the patient was able to move his hand, not able to move his hand, was able to speak, not able to speak now, see, not able to see, balance, not able to balance now, anything suddenly happening which is negative, probably, and we are looking at a stroke in evolution.
All right. Coming back to Dr. Alukar. Dr. Alukar, what do you think about the initiative Stroke Pay Rope? What do you think how this is going to create awareness out there in India, where the awareness for stroke is already quite less? What are your thoughts on this?
Yeah, it's a very, very appreciable and significant step that has been taken. And we need hundreds of such campaigns actually. The disparity, the access disparity, the lack of awareness is so significant and huge that we need hundreds of such campaigns. And I think the campaigns should not be restricted to only a particular event like the World Stroke Day, which is coming up, but they should be an all year round activity. It is highly appreciable and significant.
All right. What are your thoughts about the theme of Stroke Pay Roke as a means to create awareness towards preventive and public engagement measures?
Yeah, that's an extremely important and extremely wonderful initiative. That is stroke per roke, because if we do not have any roke in stroke, that means, and if stroke strikes us, and already the disability is important on a patient. It is the patient lives with the disability throughout his whole life or throughout her whole life. So we have to prevent stroke. So the rogue word is extremely important, because in most of the cases, the stroke can be prevented by changing all the risk factors and treating the
Yeah.
diseases which can lead to stroke.
All right. Thank you so much, Dr. Alukar and Dr. Tariq Mateen, Dr. Sukalan as well, for the insightful conversation. It was quite eye opening. Thank you so much to all of you for joining us today on ET.